Hello, welcome to the RCSI University of Medicine and Health Sciences. My name is Ciaran O'Boyle, and this evening we're going to discuss a toolkit for winter readiness. This panel discussion is part of the RCSI's MyHealth Series, and our mission with this series is to bring to you the latest research, the best advice we can about health. As I say, tonight we're going to look mainly at flu and preparing for the flu season. I'm delighted to be joined tonight by three RCSI experts who are leading invaluable research in the area of COVID-19. Dr. Fidemla Fitzpatrick is a senior lecturer and consultant microbiologist at RCSI and Beaumont Hospital in Dublin. Professor Hilary Humphreys is Professor of Clinical Microbiology at RCSI and a consultant microbiologist at Beaumont Hospital. And Professor Sam McConkey, Head of the Department of International Health and Tropical Medicine at RCSI and a consultant in tropical medicine and infectious diseases at Beaumont Hospital in Dublin. Welcome to RCSI's MyHealth Series. Hilary, can I start with you? This winter, people are particularly concerned about contracting respiratory diseases, viral diseases. Can you tell us, what are the key differences between COVID-19, the influenza, and then the common cold?
Well, if we start perhaps with the common cold, which many people will be familiar with, typically it's a mild illness. Often there isn't a fever, maybe a blocked nose, a bit of a sore throat, and people can continue their normal activities. In contrast, influenza and COVID-19 are more serious illnesses, typically in people who present with the full manifestations. So in the case of influenza, sudden onset of a high fever over 38 degrees, a cough, and particularly malaise, just tiredness. COVID-19 can be quite similar, but with additional features such as abnormalities of smell or taste. Now, other features may be, the interval between being exposed to COVID and being exposed to influenza. Generally, the interval between being exposed to influenza and contracting it is up to 4 days, whereas it can be up to 14 days in the case of COVID, although there is quite a lot of variety. And obviously, sometimes you may know the context in which you've got these infections if you know that somebody has had COVID-19. The difficulty, I think, is that there is a bit of overlap. We know that some individuals do not get any symptoms with COVID-19, or some people get a very mild illness. And the same can be true of influenza. So there is a bit of overlap, so it can be difficult.
And Hilary, can somebody be infected with more than one of these viruses simultaneously?
Yes. So what we've learned over the last number of years with better diagnostic testing, particularly molecular methods such as PCR, is that whereas previously in the past we thought it was one patient, one bug, one infection, we now find sometimes that it's more than one bug, and it can be more than one virus. Now, sometimes the virus may be a more innocuous virus, and therefore it probably doesn't have an impact. But in general, if you've got more than one bug, such as more than one virus, generally you will be iller.
And that creates a challenge clinically, I would imagine. Then,
correct.
Yeah.
And so it's having an open mind that there may be additional infections, and of course that's even before you get into infections with bacteria, which may sometimes follow the initial infection with the virus.
Very good. Thanks. We'll come back on. Fidemla, can I turn to you? There's a lot of talk now about the flu season, the flu virus, obviously. Can you set out for us what the flu season is and what the parameters of that are?
So the flu season, it's a bit like Santa Claus. It comes once a year, but it tends to come sometime in October and lasts until April, May in the Northern Hemisphere. And in Ireland, there's two sorts of parameters we use to say whether flu season has started or not. The first is clinical and the second is laboratory. So the clinical is based on 60 GP practices, and every week they report into the HPSC the number of patients they see, what they call an influenza-like illness. So that means somebody with a temperature, cough, sore throat and sore muscles. However, as Hilary has just said, lots of different viruses can cause that picture. So that's why we have the second part, and that's the laboratory bit. And the laboratory bit says, well, of those people with a flu-like illness, how many of that is due to influenza, the virus, and which types? So it's a combination of the clinical number of influenza-like illness plus the viruses being isolated. So, for example, week 39 was the end of September, and on the HPSC website, it looks like the influenza-like illness rate is very high. So you would say, oh my goodness, it must be flu season, but there's no flu viruses yet. So it's a combination of the clinical and the virus, but it will come around now.
And when it's coming, the type of virus and so on, how do we know what that's likely to be? We're following other parts of the world in that, are we?
Yeah, it's a very clever virus because it does change its appearance from year to year. That's why you need to get the vaccine. It tries to kind of kid our immune system. So we tend to have an indication from the southern hemisphere. So the types of influenza viruses that are circulating in the southern hemisphere tend to be used to inform what we're likely to see in the northern hemisphere. And generally it follows, not every flu season, but generally it follows.
And for people listening, we'll come back at the end to talk about practical things that people can do. But just at this point, Fatima, how important is a vaccine? We know we don't yet have a vaccine for COVID-19, but we do have vaccines for the flu. How important is it for people to be vaccinated?
Oh, I think it's essential, and because it's something you can do. In the pandemic, there's so many things we can't do, but this is something that's proven, it's effective. So we've two types of vaccine. We've the one I got today, which is the needle in the arm, so the arm's a little bit uncomfortable but not sore. I get it every year, and there's 4 types of flu virus in it this year. And why do I get it? I get it to protect myself, to protect my family, but more importantly to protect the patients in the hospital that I see. Other people need to get it as well. There's people that have poor immune systems, or if they've chronic diseases, or for example, my mum's in a nursing home, so people that are in nursing homes get it as well because they're very vulnerable, and then others with diabetes. So that's the needle in the arm, but there's a second vaccine available this year, and that's not a needle, and it's an intranasal, so it's up your nose, and that's the one that's recommended for children this year. And it's actually been used in other countries for over a decade and has a very good safety profile. So I get the flu vaccine every year. It's one thing I can do practically to protect myself. Apart from a bit of a sore arm, I've never had a problem with it.
So, Fatima, is it important for us to be vaccinated each year?
Yes. And it's because influenza is a really clever virus. On the surface, it's got 2 proteins. And it keeps changing the look of those 2 proteins every single year. And that's very clever because if you were a virus, you change the look of your protein so that the immune system doesn't nobble you. So if you get a vaccine one year, it's only good for that year's influenza. Next year, the surface proteins change a bit more, so you need a different flu vaccine. So it's really important to know, even if you got the flu vaccine last year, you still need to get it this year.
And then for parents watching, you know, you've spoken about the availability of the nasal vaccine for children. Could you say a little bit more? What's your advice to parents on having children vaccinated?
So the data behind this and the reason why, because most parents will go, well, why now, is unlike COVID, there is good data that children can spread the influenza virus. So the theory is if you can block that transmission, in addition to protecting people that are vulnerable, it may help reduce overall transmission. So the vaccine has been used in other countries for over 10 years. And again, if parents are concerned about the safety profile, there's very few people that can't get it. But it is some children that are very immunosuppressed can't get it, so they'll need the needle in the arm. But most children, just 1 dose up the nose. Some children, if they're in at-risk groups, need 2 doses, so the second a month later. And there's some minor side effects. But do you know what? The easiest thing is for parents to look at the Health Protection Surveillance Centre website, look under topics A to Z, I for influenza, and click into the link into immunisation. And you'll get lots of information there because, as I have said, data is power. So if you're concerned, rather than taking my word for it, look up the information and look at what the experience has been in other countries.
Sam, can I turn to you? You know, getting vaccinated is just one of a whole range of strategies for prevention, obviously. What are you expecting during this season in terms of the flu season? What's your I know these things are unpredictable. What's your sense at this stage?
Well, let me instead say what I'm hoping for. Yeah. I'm hoping that we in Ireland stay socially distanced and physically distanced from each other. So the hugging and kissing, we only do that with a very select few people we live with. We're not integrating with large numbers of people. And that's, of course, to prevent the spread of COVID-19 in Ireland, which is vitally important for our economy and for our health. And I'm hoping that that will not only prevent the spread of COVID-19, but also of influenza and other respiratory viruses. There are two reasons why I think that. One is because it seemed that there was some of that effect in what we would call our summer, but in the Australian winter time, they usually get flu in their sort of July, August time, and they didn't see that because they were socially distanced. And secondly, in Ireland back in March, April, May, when we were very socially distanced, our rate of influenza-like illnesses went down dramatically. It went down exceptionally low to about 2 cases per 100,000 per week. That's only about 100 cases in the whole country per year. That was exceptionally low, and I'd never seen that. That's been on for about 8 or 10 years. Never seen it that low before. That's about 10-fold lower than we'd expect, and was 100-fold lower than what that metric was back in early March when we were in the middle of COVID-19 in Ireland in a big way.
And Sam, the Australian experience there, was it just a delay in the curve, or was it an actual flattening in the curve? Did they not see it?
They saw very, very little. They didn't see a huge spike of influenza at all, because in Australia there's been exceptionally good control of the COVID-19, and I would put to you that they're a lesson to learn from. Both Australia and New Zealand and many Asian countries have done way better than European or American ones, because I think they'd seen SARS-1 and they realised that was an existential crisis when they met SARS-1, so they all realised, oh, that SARS is a real thing, and they had a plan on board ready to roll out to whatever level. The Chinese were ready to start at level 5 as soon as they realised we've got an infectious coronavirus that looks like SARS. They were straight up to level 5 on the 23rd of January, whereas we're still struggling to get there.
I think it was Henry Ford said the only thing we learn from history is we don't learn anything from history. Do you think that the lessons, just to take that before we come back to the lessons from SARS were adequately learned, that the lessons that were available there were widely learned and adequately
South Korea and Japan and Australia and New Zealand, certainly they were learned. We really didn't have a SARS plan here in Ireland. There was one case of SARS in Ireland in Mayo or in the west of Ireland, and they put them in a room and it never spread to anybody. They did a great job in infection control. So we did actually control SARS-1 back in 2003 with one imported case successfully. Yeah. And I think that story needs to be told. If we defeated that and it didn't spread all through, we can do that again.
Hilary, can I come back to you? Some of the people who will be watching this this evening will already have had COVID and will be recovering from COVID. And we know that there are sequelae for some people in relation to COVID. How important is it for them not to get the flu? Is that a consideration if you've already had the disease?
Well, I think if at all possible they can avoid getting influenza or the flu, then they should do so based upon experience, but also based upon what I said earlier on, that when you have two viruses, you've got a double whammy. In the Northern Hemisphere, when COVID-19 emerged, a lot of our influenza had already begun to go away. Our influenza season was relatively early last year. However, in China, in Wuhan, they did see co-infection with both influenza and COVID-19, and patients did do worse. And it sort of stands to reason. It may also depend upon the interval between COVID-19 and influenza. So if you get COVID-19 and you make a full recovery, getting influenza may not have any greater deleterious effect than if you had it normally. But obviously if you get COVID-19 and then very quickly you get influenza, or if you get COVID-19 and you've got complications such as inflammation of the heart or scarring of the lungs, then it's likely that you're going to have a worse outcome than either not getting both infections or having a big interval between them.
Right. So that's kind of, COVID has created an additional vulnerable group in our society.
Correct, particularly those who've got some of these complications that we're only learning about, people with, impairment of their lung function, people who've had this inflammation of the heart, people who are more susceptible to thrombosis or clots. These are people, I think, that would be particularly vulnerable, in addition to maybe, in some instances, underlying diseases that may have, such as chronic heart disease or chronic renal failure.
And has that been a bit of a surprise to see the extent of some of these equality, that they go on for such long periods of time for some people?
I think it has, because traditionally, coronavirus is the typical coronavirus was a relatively mild illness. It was a respiratory illness, and to see these long-term complications, or what we call sequelae in patients, is new. And we still don't know how long that will last for. We don't know what the full implications will be and whether people will recover or not.
It's a good idea not to get this, because you don't know what the implications really are. There's a degree of a lottery there. Sam, there's a great deal of research going on here in RCSI and in other parts, in other places in Ireland and internationally indeed. Could you give us an example of some of the kinds of research that are going on here in the college in relation to COVID?
So we're a collaborating partner in a multi-centre clinical trial run by WHO and sponsored by the Department of Health called Solidarity, which is to see if a small molecule called remdesivir is better than placebo when it's used early on in people who need oxygen.
It's become very famous in the last week, I think.
It has, and some people are using it, and we're actually studying to see if it really works or not. At present, it's in a phase 3 clinical trial. The early data suggests it's effective and safe, but only just a little bit effective. So I think we'll need more powerful or combination drugs, but a little bit effective is still better than nothing. We're also looking at a promoter of alpha-1 antitrypsin. We have a very strong alpha-1 antitrypsin research group here, and to see if that also may help the outcomes. We've a group looking at facial trauma from some of the masks that people have to use for CPAP and BiPAP. We have a group looking at clotting abnormalities. Unfortunately, COVID-19 causes little clots in the body, in the kidneys, in the brain, and the lungs, and trying to understand more about that. We also have a very interesting one about breath tests. Could a breath test of breathing into a tube, and I volunteered for this one, where I breathed into a cold tube for, I think it was 2 or 3 minutes, to see if my exhaled breath could accurately detect COVID-19. And we compared that, of course, to the usual nasal swab and to blood tests for it. So that's a diagnostic test that's been evaluated by us as well.
So there's a whole range of different approaches taking place here. So if we turn, Dermot, to the really practical advice for people now, we're facing into winter. We were talking about this in the last of the MyHealth roundtables about the mental health impact on this. But if we leave that to one side, if we're going to respond appropriately to the flu season this year, what are the kinds of things we should really be doing then?
And I think that's probably the best thing to do, is to try and respond with practical stuff, because it's been a really tough few months for everybody. It's been obvious for us in the hospitals, because we've been in the hospital looking after patients. But even in our own lives, it's been very, very tough. We've had to distance from partners. We haven't seen friends and family. Some people have lost their jobs. It's been pretty tough. And now we're heading into winter, which is great fun altogether. So there's no sunshine in a way, and there's the general mood of ugh. So for me, when you head into winter like this and you're talking about respiratory viruses, there actually is a few practical things you can do. And the first is the vaccine. So get the vaccine if you should get it. And the HPSC website has the full list of people that should get it. And briefly, they are people that are very vulnerable to infection, be it underlying diseases, or if they're living in nursing homes, people like me, healthcare workers. And this year, as I said, there is a new vaccine. There's the intranasal one for children, and that's recommended for children 2 to 18. And it's free for 2 to 12s. The second thing is the mammy advice. And in a way, we probably should have all listened to our mammies. It's to keep the car going, put petrol in the car, eat well, exercise, hydrate. Sometimes you have to have a bit of a laugh, and that's good. We all know that's good for the immune system. The third thing is hygiene. It's back to mammy advice as well, because it's a respiratory bug. So carry tissues or cough into your sleeve, and then don't forget to wash your hands and also clean up the general environment. The last thing I think is data and get informed, because sometimes when things feel very overwhelming, which they do, we're living in very unusual times, go and find some accurate data. So there's a good website called undertheweather.ie, which does what it says on the tin, and you can look it up and it tells you what to do, how you can, if you're feeling unwell, what you can do yourself, but more importantly, if you're very unwell, when you should go to a doctor. And then the HPSC website has lots of information, very good fact sheets, and lots of data about flu and also about COVID. And then lastly, the COVID data hub. And there's a huge amount of detail. So I find myself, and I know it is my field, that if I find figures are scary, the best thing for me to do is actually go and look into the figures and find out actually what they mean. So I think those four things are practical things.
So that's very practical advice. I must say I find myself, the amount of information is overwhelming and it's continuous. Is your advice, I think the advice to people is, you know, kind of you need to turn off from this sometimes and make sure the information you're getting is accurate, because there's a great deal of what I would call dodgy information out there. Would that be a fair comment?
Oh, absolutely. And I think it's been overwhelming, the data on COVID and the amount of information. Even in the scientific literature, you know, papers are being published and pre-printed at an exponential rate. Actually, there's a pandemic of publications, never mind the virus. So it really is overwhelming. You know, and sometimes turning off, including turning off your phone and social media, is the best thing, and go out for a walk or just sit and chat to people. And if you are going to look for information, look for reliable websites, and that's why the Health Protection Surveillance Centre one, and if you specifically want to look for data on COVID, the COVID Data Hub is excellent.
Yeah. Okay, that's really good advice. Hilary, if I can come back to you for a moment, you know, let's just say, for example, there is a surge, you know, a flu surge this year, as we've seen in other years. What are the ramifications for you guys on the front line, for the health service generally, of something like that?
Well, it's challenging. I think it's fair to say that, because there's a degree of uncertainty about it, and it's the uncertainty for everybody that I think is the most challenging thing. I think, you know, what we've seen to date is quite a degree of innovation, and people have adapted and prioritised what needs to be done. So really to manage those patients who are most in need of care, and to try and see whether some patients can wait to have their care. And I think the other thing that what we've learned, I think, in the health service to date is the capacity for people working together in ways that perhaps we weren't aware of. And I think a decisiveness that previously was not the case. Previously often it took ages to get a decision at various levels as to what to do. And I think what we've seen over the last 6 months is a kind of a different way of doing things, and a more innovative way of doing things. But clearly, you know, if the numbers go up and there's great pressures, that does stretch the system, and it makes it more difficult for people in the health sector. So people outside in the community generally doing the things that we're trying to recommend that they do really helps us, and it's hugely appreciated.
So it has a double effect. It prevents them getting sick themselves, but it also assists the health service to be able to continue.
Absolutely,
to cope.
and if you look at the curve that happened in the spring and the early summer, you know, that meant that first of all there weren't so many patients that needed treatment for COVID, but it also meant that we were able to open up the hospital for other patients who were delayed in their treatment. And so at the moment, you know, we're trying to keep both obviously managing COVID patients, and we're also trying to manage other patients who need planned urgent care. And, you know, we want to continue to do that, and we can continue to do that if people take the advice and help us in providing care to them when they need it for non-COVID illnesses.
Somebody said that we keep talking about the new normal, but it's not really all that normal. You know, what do you think people should be doing just to make sure that they maintain their mental and physical health as we move into this winter period now?
I think this time is very, very worrying for many people. There's almost, you know, 2,000 families now that were bereaved earlier this year, and financially, we know, you know, 200,000 or 300,000 people are unemployed because of this, and there's a lot of uncertainty about will those jobs come back and will more people come employed. So I can understand a lot of issues there. The practical things, I agree with what Fidelma said about the grandmother treatment, I call it, rather than the mother treatment. Those practical things of actually eating regularly and hydration are important. To that I would add the importance of sleep. Many of us don't sleep enough, and just getting to bed on time and getting ourselves in the bed for as much sleep as our body needs is profoundly important for all of our mental and physical health. And the second thing I would emphasise is really regular physical exercise. I know Fiona euphemistically said move a bit, which is fine, but I think we could move a fair bit and move a lot, and that getting regular physical exercise, you know, if you're not sort of sweating half an hour a day on average, you probably should be. And I think there's then in terms of, you know, who we are and our meaning, it's about asking how can we help the people around us. There may be many people in our community who struggle to get through this on their own, so we actually need to reach out and say, who are our friends that we haven't been in contact with? We've all got these fancy phones now that allow you to see and talk very, very well. We're very connected, and we should use the technologies, whether it's Skype or WhatsApp or whatever, or Zoom we're all using, to actually talk with our friends and have fun. And if that involves, you know, these Zoom quizzes where each family or whatever makes up their own, because we've all done these things, and we never did them before 2020. But yet they're actually quite fun in some ways. So we need to find new ways of being together and having fun with our friends and creatively, because we can't all get together and play board games or in our homes or go out to the pub together. So it's a matter about finding ways of just being human with the people we care about and having fun with them.
Yeah, and we're a tough, adaptive people. I mean, we have adapted down through centuries to all kinds of things. That's a really interesting list there. It's great advice. It's interesting that last week, on the last of these, when we were talking about mental health, Professor Jim Lucy was talking about the importance of sleep also from a psychiatric point of view. So are there particular benefits in terms of our immune systems from actually getting adequate sleep, or is it a more general health kind of advice, Sam?
I think it's a more general health advice, particularly about mental functioning. The data that you just sort of stop functioning well as a human being, as in being able to be creative, being able to have strong, positive human relationships with others, and being able to function effectively in making complex decisions over a stressful time, which we're all in a stressful time. So sleep is a necessary ingredient to that. Trying to measure and sort of, I'm probably a fairly critical, nerdy scientist, and trying to measure immune system changes linked to sleep is quite complicated. But there's no doubt that sleep deprivation is essentially a torture, you know, and we all become dysfunctional when you lose a lot of sleep. But even when you lose a little bit of sleep on a regular basis, it has an impairment on our functioning.
Yeah. So as we're coming to the last stage of this, I think one of the things that a lot of people are finding is there's a great deal of unpredictability out there. They have a sense of sort of a lot of things that they had control over, they no longer have control over. So all three of your experts working in this area clinically, what would be your kind of takeaways for people at this stage?
Spring is around the corner.
Yeah.
And I think there's always an end there's a beginning and an end to the flu season. And I think it will be interesting. A lot of the things we're doing for COVID will for sure prevent transmission of other respiratory illnesses. And I think we're all very focused on hygiene and respiratory hygiene. So I think that'll be something that'll be interesting to track. But do you know, at the end of the night there's the day, and at the end of winter there's spring, and we get through flu season every single year. It's tough. Flu is not to be underestimated. Last year over 4,000 people ended up in hospital because of flu, and over 100 people died. So this is not an insignificant illness. But you know, we will get there. It's a bit more complicated because of COVID, but sure, the year has been complicated. So my take-home message is that focus on what you can do as opposed to what you can't do, because there's a lot of discussion about what we can and can't do, and I personally think if I can do stuff, it gives me back a sense of control.
Well, I would have an optimistic frame in the sense that I'm personally somebody who believes that glass is always half full. And in saying that, I do acknowledge that obviously a lot of people have suffered and lost loved ones and continue to be under a lot of pressure. But I take some optimism from two things. Number one, history. People say you don't learn from history. I think we often learn quite a lot from history. And if you look at history, you can see how mankind has adapted enormously over relatively short periods of time, including in our own country. And I see evidence of that in the scientific and biomedical community. The rapid development of diagnostic tests in a matter of weeks that previously took years, the progress that's been made on vaccination, the global cooperation that's taking place, that gives me hope. So I think we've learned so much about this virus in such a short time. I also take some optimism from how people have responded to it. I think it's, if we look at what's happened in this country and other countries, how people have cooperated, how they've supported each other, how they've taken the advice, done the simple things. And I think they need to continue to do that. But I would caution us to be careful that we don't condemn, that we support, we encourage, we help each other, rather than being too judgmental about people, because it is difficult and we sometimes don't know other aspects that are going on in their individual lives.
And that might apply especially to young people, because there is a tendency to vilify young
Absolutely.
people, but they have lost out hugely.
I think it's a very difficult time for young people, more difficult for others, and it's a time in your life when you want to go out, you want to learn, you want to experience, you want to grow up, and that's being denied them in many instances now.
Yeah, I think it's very difficult for young people. Thanks, sir. Sam, what would your takeaway be for people?
So I suppose I'm 31 years qualified now as a doctor and spent most of the time looking after people with infectious disease, many with sepsis or HIV or TB, who are really devastated when you have to tell someone they've got HIV and maybe they're very thin and feel they're about to die and all their family think about it. Trying to find life out of that is a real challenge. And I suppose out of this time, I would recognise that so much in people's lives have changed. We're now seeing the news, every morning, evening at 6, tell us how many people have got COVID and how many have died. And our lives have changed in terms of work, in terms of ability to travel. So we could never have conceived that these changes would happen. So we're all struggling to find life in the midst of all this change. And that's really, really challenging. So my view is what we each have to do is go back to the things that we really value and trust, our personal values, our social values, that we had back last year and the year before and before that, and then find ways of living those out and putting those into practice. And it could be community building things, it could be kindness. Each individual has to find those and ask themselves what were their social values that they had before, and those can continue just in a different way. So there will be continuity of who we are, what we stand for, what we're committed to, what we really want to achieve in the world is all possible in the future as in the past, just in different ways and within the restrictions.
And I think we'd all agree that every individual has a role to play in that. It's for everybody. Every single person can make a difference. Well, that was really fascinating. Thank you all very much. That concludes this evening's discussion. My sincere thanks to our experts, Dr. Fidelma Fitzpatrick, Professor Hilary Humphreys, and Professor Sam McConkey. The next event in the RCSI MyHealth Series, Supporting Child and Youth Health this Winter, will air on Tuesday, the 24th of November. I'll be joined by Professor Mary Cannon, Professor Paul McNally, and Professor Jonathan Hurahan to discuss supporting the health and well-being of children and young people this winter. And as we conclude this roundtable on getting winter ready, I leave you with the thoughts of the great Irish writer John O'Donoghue, who sadly died a number of years ago. He said that it's not that nothing is happening in winter, spring is being born out of winter. Good evening and stay safe.